So most people probably remember Mpox from 2022. Back then, we were calling this disease monkeypox. So around that time, scientists decided to rename the disease Mpox to reduce stigma. The virus, though, is still called the monkeypox virus. And what was happening then was an unprecedented spread of Mpox around the world. So in the past, Mpox really didn't get very far. So typically, what happens is that someone contracts the virus from a wild animal, usually some kind of rodent, and that can be through an encounter with an animal, a scratch or a bite, also through eating undercooked bushmeat. Anything like that, the virus can then infect a person. And then once the person is infected, they can infect others. The lesions on the rash, for example, are very infectious, so you don't want to touch them. But usually transmission requires close contact. And typically you'd have these little outbreaks, but they'd fizzle out because it's relatively hard to spread. There are two main types or clades of the virus, and this ongoing outbreak, the global one, was clade 2. And so this increase that we're seeing now is in clade 1, which has never been seen before outside of certain parts of Africa. And clade 1 has historically also been more severe than clade 2, although there have been signs so far that, the current cases that we're seeing haven't been quite as deadly as the past numbers would suggest. So it's still a little unclear, but there is this concern that what we're dealing with is perhaps slightly more lethal than what we saw before.